know that doctors can be able to look inside your body? Welcome to Wellness Health Talks. I'm Dr. Joshua Derito, family physician. I have interest in cancer prevention and also public health. So today we will look at the procedure of endoscopy. Endoscopy is the procedure whereby a tube or a scope is put through your mouth, down your gullet to the stomach, and also part of the intestine, what we call the duodenum. So usually this procedure is indicated if you have persistent abdominal pains, especially affecting your upper part of the abdomen or around the area of the stomach. If you have persistent heartburns, if you have persistent gastric reflux, if you have difficult swallowing, if you have listened to some of the previous videos, we have talked about difficulties with swallowing. We have also talked about gastroesophageal reflux disease. So if you have some of those conditions, then endoscopy is indicated for you. If you have persistent anemia, whereby it is iron deficiency, which is anemia of loss of blood, and the main cause cannot be established, then an endoscopy is indicated to find out whether you could be having an ulcer in your stomach or in your duodenum where you are having a loss of blood. If you have blood stools, you are passing fresh blood through the anal region, or if you have what we call starry colored stool, that is dark stool that seem to be blood stained, then there is indication for an endoscopy to be done. If you have unexplained withdrawals or unexplained vomiting which is persistent, then an endoscopy is indicated. So what happens before the procedure of the endoscopy? One is before you come for the endoscopy, of course your doctor will have told you that you have these symptoms which need to be investigated with an endoscopy, and you need to fast for a period of 6 hours. If you are doing the endoscopy around day, at least you need 6 hours of no food, so that the doctor can be able to see well the lining of the esophagus, the stomach, the duodenum. If you take anything, then the procedure becomes not possible, because when we put the scope, what we see is the food that you have eaten. So you fast for 6 hours, and then you sign a consent form, and then you are, before this procedure is done, if you have been taking drugs like blood thinners, then you may need to stop them, because this could be a risk factor for bleeding, and you may need to stop them. So once you are ready, you have been put on the table for the scope. This tube, which has a camera and it has also a light, you can see from this is the screen, and you can see, if I put the light on, you can see that you can be able to see my hand. And this is what happens now. If you put it through the mouth, then you are able to see the mouth, you are able to see the esophagus. As you go down, you see the stomach, and the doctor will follow up the lining of your wall, and he can follow it through up to the level of the duodenum. And any abnormality like an ulcer can be seen, bleeding vessels. If you have any obstruction or any growth, if you have growth we call polyps in the stomach, then it can be seen. And this, through the same procedure, there is a fine wire that can be put through the scope, and then a specimen can be taken for histology. Histology is whereby you put the cells that you have picked into a microscope, and you are able to diagnose what is the problem of the patient. You can be able to diagnose conditions like cancer of the stomach and cancer of the esophagus. You are able to see, like if it's an ulcer, you can be able to take a specimen, establish whether that cancer, that ulcer is cancerous, and also you are able to tell if there is any infection with H. pylori from the specimen taken. This same process can also be used to remove some of the polyps, and it can also be used to bud if you have enlarged blood vessels at the level where your esophagus joins the stomach, you can use this endoscopy process to bud those vessels. So what are some of the complications that you may get with this process? Of course, before this scope is put, you are given sedation so that the process is not painful. The anxiety that the patient might have is well taken care of, and also we also use flow anesthesia, especially at the throat. The process is not painful, and it takes about 15 to 30 minutes to do a normal diagnostic endoscopy. Of course, for the treatment procedures like budding, then it might take more, but not more than 45 minutes. Then after the process, as I said, some of the complications include, because this, to be able to see, there is air that is infiltrated so that the organs open up, and you may feel some fullness. There is some discomfort as the tube is inserted, and of course, as any procedures that you are not conversant with, there is the associated anxiety. So after the procedure is finished, the doctor will explain to you what he has seen, if he has taken a biopsy, and what you expect afterwards. And the problem that you might have will easily have been identified. You may need to rest between 30 to 45 minutes, and then you can go home. So this is not a procedure that is so invasive that you cannot get to your back to your normal life. Of course, we encourage you after the procedure that you don't drive yourself, because there is the effect of the sedation, and this can affect your coordination of things, and also your memory might be affected. So we encourage you that for 24 hours after the procedure, then you don't engage in any mind-provoking procedures, so that this might not be affected. The memory is partly affected, but this is very temporary for only those few hours after the procedure. Otherwise, after that, you can go back to your normal activities and the procedure, apart from those few complications that I have indicated. It is very safe. So if this usually endoscopy is not used as a screening method, it is more of a diagnostic procedure. So it will be done because you have a particular indication that needs you to have the endoscopy. So thank you very much for watching. If you have any question, if you have had this procedure done on you, please make your comments on the video so that you can share your experiences with others, so that they may also have. And if you also have questions that possibly this procedure has been prescribed to you, and you have been having your worries and doubts, and you want to hear from us or from others who have gone through the procedure, it is very necessary. So make your comments and let us engage, so that we make our health care better and better every day. Thank you for watching.